welcome to Season 3, Episode 12 of the Press Box. I am Justa Encarnacion, Commissioner of the Virgin Islands Department of Health, and your host today. Thank you for joining us. My team and I want to share some of our new initiatives to improve your health and balance your wellness. We will also talk about the projects focused on our department's infrastructure, like our plans to rebuild the Charles Howard Memorial Complex on St. Croix and the new WIC building in the Newt Hansen Complex that's on St. Thomas. And listen, that's just a sneak peek. There has been quite a bit of talk surrounding monkeypox. Dr. Hunt Caesar will join in a frank discussion about the myths and truths about the monkeypox and update you on where we are with COVID-19. And yes, COVID-19 is still here. Joining Dr. Hunt and I is Assistant Commissioner Ruben Malloy, who will lead the discussions on infrastructure conversation. Lots to talk about, so team, let's get started. Dr. Hunt, the first thing we spoke about, even though I talked about monkeypox being one of the last things, I want to get into the monkeypox discussion. What is monkeypox?
Well, Commissioner, thank you for having me. And monkeypox is getting quite a bit of discussion globally and in the nation, and we are preparing ourselves here in the territory. Thankfully, we don't have any cases yet, but monkeypox is a rare disease that unfortunately is now, because of a recent outbreak, is spreading a little bit more commonly than it used to. It's a virus that's caused by the monkeypox virus. And what is the monkeypox virus? It's something that's very similar to smallpox, and a lot of older people know and have experienced and know what smallpox is, but monkeypox is actually much milder than smallpox, and it's rarely fatal. So it's very similar in that you can actually have sores and skin lesions that follow what we call a prodrome of like a flu-like illness or fever, feeling tired, and sometimes even having swollen lymph nodes.
And so is monkeypox all over the world right now?
It is. It's actually spread now to the majority of the cases now are seen in countries in which you have never seen monkeypox before. And this is different to the previous outbreaks in which we've commonly only seen it in some regions and areas in Africa. But because of just the way that it's spread and how it's and its contagious nature and our globalization and the way we live today, sometimes we will see outbreaks like this. And it's now seen in a lot of the countries in which we haven't seen it before.
Okay, so break it down for us. Internationally, how many cases?
So there are there are more than 100,000 cases globally. I think there are about maybe 131,000 cases.
And then let's go nationally.
Nationally, we have about 13 or 14,000 cases nationally, and just more closer to home, we have 66 confirmed cases in Puerto Rico.
And that's actually very close.
Absolutely.
So, you know, in the Virgin Islands, we have a lot of individuals traveling back and forth. So the question is not if, but when.
Absolutely.
So do we have any cases here in the territory right now?
We do not have any confirmed cases in the territory, but because we are trying to stay on top and provide education and prevention and try to mitigate spread, we have been testing any sort of suspect cases. And I really haven't been convinced that a lot of the cases that have been presented are suspect cases, but any sort of rash with blisters or sores, and especially since some people might be a little bit afraid, we have been sending samples, and we've sent 10 samples out for testing so far. 8 of them have returned negative, and we're still waiting on 2.
And we're praying that those 2 are negative as well.
Absolutely.
However, if they are positive, what is it that we have in place?
Well, that's what we do well at the Department of Health. So we plan and prepare, and we have been planning with the national jurisdiction partners, just like how we have been very accustomed to planning with COVID.
Right.
So we have already been in contact and have set up our emergency operating center that has been activated in case there is a case, so that we can have all of the procedures in place for treatment as well as prevention. So we have received the Jynneos vaccine, which is the vaccine that the CDC and the FDA has been approved for monkeypox prevention. And we have acquired 160 doses of those vaccines in the territory
Well, it's
already.
actually more than 160 doses, right?
Correct. So we have 160 doses and 20 on the way. That would give us 180 doses. But with a certain way that we can actually introduce the vaccine,
Right.
we can actually extend it to 5 times that dose amount. So we have an excess of at least 500 or 600 vaccines that we can actually start to distribute and vaccinate.
And when will we start to do that?
We are starting to vaccinate even as we speak. We're planning a certain subset of populations, and then we are going to announce to the public who we think fits the criteria, who is eligible for, who we feel are at higher risk of being potentially exposed to the virus.
Okay.
And we're going to begin that more than likely next week, in the close to next week, and maybe even within the next 2 weeks.
And I know that one of the teams we have one team that's focusing on communication, one team that's focusing on education. So what are we doing to let the public know? Besides this is one way for us to
Absolutely.
do that. But what other things are we going to do, put in the public so they can understand better what monkeypox is all about?
So again, public health basics. We are about education and prevention. So we are trying to get the information specifically to targeted populations who we see are affected right now.
Right.
And education is so important because while we want to get the messages and the treatments and the vaccines to the population that we are seeing is affected right now, we know exactly the way that viruses can spread, and we know that eventually it's going to spread outside of that population. So we need to get the messages to the entire public.
So anyone can get monkeypox?
Anyone can get monkeypox. It's actually an infection that is spread by having close skin-to-skin contact with anyone who has lesions. So while we are seeing a lot of the infections globally in the nation in a certain population of persons, we are seeing it spread throughout all demographics.
You know, we said we can have a frank discussion, right?
Yes.
Okay, so the most that we're seeing right now are men having sex with men.
Correct.
True?
Yes.
But I think that the public needs to know that that's not the only scenario that we may be looking at.
It's not. So we're seeing monkeypox that's being spread in all the demographics, and we're even seeing it in children and
That's right.
and in pregnancy. So any sort of intimate contact, you can be exposed.
And that's a stigma we're trying for everyone not to even focus on. So in other words, we want to make sure that everyone continues to be treated
Absolutely.
in an equal manner.
Yes.
Something the Department of Health has really been trying over and over again. We started off with COVID, and we know that there was some disparities throughout the nation. People of color, are they getting the vaccines?
Absolutely.
Hispanics, Latinos, are they getting the vaccine? Same thing with monkeypox.
Correct.
And I think it's important for you to know that we have started the same process, because I believe that consistency is what leads to success.
Correct.
Right? So our EOC has already been started, like Dr. Hunt said. We've identified who is our incident commander. We have our leads. We pull in our communicable disease division a little bit more
Absolutely.
with monkeypox than we did before. We had someone from Columbia University speak to us. I thought that was an excellent conversation, very descriptive. And we had our staff ask a lot of questions.
Absolutely.
And we will do the same thing to the general public.
Yes.
Right? So that's one of the things I want to make sure that the public knows how much
Absolutely.
we're doing. What about our
Partnerships.
school systems?
So I think it's very important that we try to educate the public, and one of the best ways to educate the public is to make sure that we educate our children in schools. They take messages back to their homes, their communities, their parents, and it's also the workplace and schools are homes away from homes, and we know that you can have intimate contact, very close contact sometimes when you're playing, when you're in school, etc. So we are partnering with the Department of Education to make certain that we go into the schools and we ensure that students are aware what this virus is, what it's about, and make sure that they know what they need to do to prevent it.
No, we're going to be speaking about disparities a little bit more. But what can we do right now when looking at monkeypox to reduce exposure?
What the biggest thing is to just familiarize yourself with exactly how the disease is spread, so that you know exactly what to do to avoid potential infections without even knowing. That's the best thing to do.
Do you recommend frequent hand washing, always having your hand sanitizer close by?
Absolutely, and that's with any sort of contagious infection. Hand hygiene is always the best way to prevent any sort of illness that is spread from person to person. What we need to be very careful about is and understanding is that this is not something that's spread as easily as COVID. It's not something that you can really catch just from someone being around and breathing in the same air as they are. But monkeypox can be spread by respiratory exposure in very, very rare instances, but that's with very prolonged exposure with someone. But it's not like the chicken pox where if you're just so close to someone you can get. It's really spread with close, intimate skin-to-skin contact.
Okay, so we've been doing a lot in the Department of Health, and sometimes I feel as though the community connects us with COVID, but there's so many things that we've been doing. But as a result of COVID, we were given a grant, a disparities grant, and we've taken that disparities grant and we've created an Office of Health Equity. And I honestly, that touches me. I think that is excellent, and something that has given us a little bit more initiative, a little bit more stamina. What are we going to do with this division? And so we're working with chronic disease, decreasing chronic disease, but the way that we're doing it, I love. And that's, me. When you speak to children, you speak to me, right? So with our MCH division has really done a tremendous job being a production for the Department of Health, being the word for chronic disease, as well as other initiatives. So we're looking at starting chronic diseases, speaking about them in the pediatric population, right? Because if you speak to a child, you speak to their parents.
Absolutely.
Correct? So we're going to get AC Malloy out there to do some dance with us, with Dr. Myers in a couple months here. We've really been doing a good job with that. So we'll continue to do that. But we're also linking that with our chronic disease program, who really right now focuses a lot on adults, but we're getting them to work together, speak together, and really figure out how we're going to track and trend. We had a discussion a couple of days ago, and in our public school systems, we see more obese children. Obesity leads to hypertension, diabetes, more chronic diseases. So the goal is, if we can look at that and say, you know what, in 2022, we had a percentage of obesity within our school system, and let's say 2025, we look at it and we say, well, you know what? We can actually compare it and see the decrease in it. We have so much more to talk about. So this is exciting stuff. We're going to take a little commercial break and be right back. Thank you.
But what you saying, Jenny? Me taking a hot minute, you know. We're going to say that it's been a hot minute for a reason. You want to know something? My mother told me that I can't come out my house because of COVID-19. I know we ain't safe out here for a little bit, but still I just have some fun though. Well, my side can't leave the house unless I'm vaccinated. But you won't scared of the vaccine? Nah, sis. The vaccine's safe.
VIP people, you must stay at work. COVID-19 is not a joke. It's much more than good hygiene. Give your children the vaccine. Education is the golden rule. Children need in-person school. They miss music, dancing and sports. Vaccination is better not worse. I want the COVID vaccine. Give me the COVID vaccine. It's safe, mommy. The vaccine safe, safe, safe. I want to see my friends and family. Playing with them makes me happy. It's safe, mommy. The vaccine safe, safe, safe. Children can become infected, get sick, and spread COVID-19 to others. Widespread vaccination is a critical tool to help stop the pandemic. People who are fully vaccinated can resume activities that they did prior to the pandemic. The MCH division encourages you to get your children ages 12 years and older vaccinated. I want the COVID vaccine. Give me the COVID vaccine. It's safe, mommy. The vaccine safe, safe, safe. Brought to you by the Virgin Islands Department of Health MCH program.
Let me know if you need.
Babe, I got a medicine. I'm on my way home now. They also have some Alcalado, so I picked that up too.
Wait, did you get the right one? You know Kyra likes the grape flavor better, and she's so fussy right now.
Yes, Jay, I got the grape flavor. I also called Ma, and she said to wipe her face with a cool rag until I got home.
All right, babe. Hopefully, we can all get some sleep tonight.
I know, right? Kyra will be okay, babe. I'll be home in 2 minutes.
Wait, is that the seatbelt alert? Why aren't you wearing your seatbelt?
Man, Jay, don't start. The seatbelt ain't that big of a deal. I didn't see any police on the road.
You know that makes me nervous. Tickets aren't the only problem with not wearing a seatbelt.
I'm right around the corner.
Buckle up. It's your life. It's our law. This message is brought to you by the Virgin Islands Office of Highway Safety.
Welcome back to Season 3, Episode 12 of the Press Box. This is Commissioner Encarnacion from the Department of Health, and I have here with me Dr. Ty Hunt Caesar, and she is our Medical Director in the Department of Health, and of course, our Assistant Commissioner, Ruben Malloy, is here with us today. I want to go back to some of the conversations we were having before, but I want to focus on health disparities and health equity. So tell us a little bit. I know we had a summit just about maybe 2 weeks ago. What was that summit all about? And go a little bit further as to what we're going to do with our grant funding.
Well, health disparities and health equity is at the core of what the Department of Health and Public Health should be focusing on. I love always to talk about the reasons why we're here and what we should be addressing, which is something that we always discuss in health equity, is the social determinants of health. Okay. So that summit was a very interesting summit, and we were able to discuss and have good conversations with all of the staff that we recently hired. And I was extremely excited to have conversations with our newly hired community health workers. And I think that is what I'm most excited about. It's been a dream of mine to finally have community health workers and the Department of Health to bridge the gap, to bring the care to the community and actually bring so have workers actually bring the patients to the clinic, because I think that's where we have lots of challenges and barriers. And I thought the most exciting part of the summit was just hearing ideas from them. Mm-hmm. And how they think and feel from their assessments, what they think that how they can be beneficial. So I am just most excited that we are going to actually have people in the community who actually know exactly what the challenges are, so that they can bring back the ideas to us, so that we can make interventions that are customized and tailored exactly to the people who we seem not to reach.
Okay, so let's define social determinants of health. Absolutely. For the general public.
So the social determinants of health is a fancy way to say what are all of the factors that determine and affect how healthy or how not healthy you are. So it's where you live, where you work, where you eat, and your financial situation.
And to give the general public just a few examples, right? Mm-hmm. Let's say, for example, you're a child, you're asthmatic, mm-hmm. you live in a home with a lot of dust, mm-hmm. rugs all Absolutely. Over the place. Mm-hmm. Looking at the social determinants of health for that particular person would mean finding a way to get rid of the rugs.
Absolutely. Rather than trying to treat the asthma.
Correct.
You're trying to look at exactly what's in the environment to mitigate that risk factor altogether and prevent it from actually becoming worse.
Okay, now let's link it to the community health workers. Mm-hmm. The community health workers are individuals that we're taking from select little communities within our bigger territorial mm-hmm. community, mm-hmm. and they go into the homes, speak the same language mm-hmm. like they do, mm-hmm. whether it be English, Spanish, Absolutely. French Creole, or others, mm-hmm. and then they identify what's causing those social determinants mm-hmm. of health. And then we know right. what we can do best to help. Correct.
And they serve as just like a navigator or many things. They can be an advocate, they can be anyone who can help that patient or that community member understand the network and understand what to ask. And another major component to why I think that community health workers are important, and especially important, is because they really promote empowerment. Mm-hmm. And what I think that sometimes individuals in the community just don't think that they have what it takes to, to be successful within their healthcare plan.
And they feel more comfortable speaking with someone
Absolutely.
that they know.
Yes.
Okay, you and I could talk about this all day,
All
right?
day.
So we're going to shift.
Yes.
Like Assistant Commissioner Ruben Malloy has been very patient with us. First of all, congratulations as our new Assistant Commissioner of Health.
Thank you.
Well deserved. I have to say this to everyone. Dr. Nicole Kragelson, the Great, is still around. She's not here with us today because she actually has some other things that she has to take care of, but we miss her, especially speaking about behavioral health and some of the other initiatives that we're doing. So a couple weeks ago, we had the honor of coming together, Governor Albert Bryan Jr. was there with us as well as other dignitaries. Senator Francis was there. But we gathered together. We had a communication with the community. What was that all about?
That was our first attempt at reaching out to the community and getting their involvement and getting their input in designing our new Charles Howard complex. As we all know, the complex one-stop location for our services, public health services, was severely damaged during the hurricane, the 2017 hurricane. Since then, we've been doing whatever it takes to secure funding from FEMA Public Assistance Program, to rebuild the facility and be able to provide the services.
And you and your little team have been quite successful. So what funding are we looking at to rebuild Charles Howard?
The funding is $250 million.
Say that again?
$251 million from the FEMA Public Assistance Program. The little program is our project management and capital projects division, led by the great Rosalinda Brown, and with the support of Office of Disaster Recovery, Wood O'Brien, and other external sources, we've been able to achieve, bring the project to where it is right now.
So where are we in terms of the design portion of the project?
We've completed the 30% design, which means that the external, the platform, the footprint have been established. The layout of how it will look externally has been settled on, and then we've been having multiple meetings with our divisions, 3 or 4 rounds, getting what their requirements are for the facilities, the environment, to provide the services that they provide.
Okay, so are we going to have different services in the new building?
We're going to have the existing services, but we're also going to have some new services.
Let me tell this.
Yes,
Okay.
you get the honor. Yes.
So this is exciting for me. One of the things that we're looking at is a health and wellness segment of the new building. So you walk in, right? And first of all, the building is gorgeous. But when you walk in, the first thing you see is you meet someone who greets you. But when you look forward, you see a health and wellness division. And behind of that is a 200-seating auditorium that you actually have educational sessions there. We have a kitchen that you can actually come learn. WIC is very excited about that. But we're introducing, going back to the social determinants of health, health equity, making sure that we are allowing the public to tell us what they need, they really need. Okay, I'm gonna stop now and tell us a little bit more about what's going on.
Well, to add to what you're saying is your focus has been on prevention, and you have made that known and have required us to keep it top of mind. As far as some of the other projects or the Charles Howard, so we're really excited about Charles Howard.
Before you go to some of the other projects, I know that we're trying to start a Facebook page that focuses on all our projects. But Charles Howard will be there as well, so that the community can still go in and give us some feedback from that, right?
Yes.
Is that one of the plans? Okay, so go ahead and tell us about some things that are happening on St. Thomas.
on St. Thomas, the Charles Howard project is the largest project in our portfolio. On St. Thomas, the largest project is the USDA, United States Department of Agriculture, funded new WIC building, Women, Infants, and Children. For many years, there has been that structure there, look like ruins. We've demolished that, and we're have plans with the assistance of ODR and Springline as the architectural engineering firm to build a 5,200 square foot for $5 million facility. So we're really excited about that, and that project is actually the project that's furthest along. The contract has been awarded to J. Benton, and that contract is about to be signed and will be our first project where we break ground.
Now, it's important for the public to know that we cannot do it without you. We have been working on these projects since we came together. That's about 3.5 years ago. But it's always been important to have your input as to what we're doing, because and one of the things going back to Charles Howard is it's because that structure has meant so much. I don't want Ruben to start to talk about this because he's going to be talking all day about how much Charles Howard means to him. But it has meant a lot to all of us. You were born in Charles Howard as well, correct?
Yes.
And you played around that area. Senator Francis was able to tell us all about how much he played in that area, how much his mother played a part in Charles Howard. And now tearing down of that building is also heartfelt to many of us. So is what's going on in St. Thomas. We have to tear down a little bit so that we can renew. But we're not taking away the memories. And we are not taking away the function. We're actually enhancing the function and creating new memories all throughout. So I want to thank you and your team for being part of that. And I know that IT infrastructure is something near and dear to your heart. So before we go to commercial, just tell us a little bit of what we're going to do from an IT perspective in the new building that you're putting together.
Well, the new building will be a state-of-the-art building. And what we're doing in preparation for that, we have upgraded our Intergy system. We're currently, as we speak, going through training to ensure that our users are fully capable of using the system to its full potential. And we have, another brilliant thing that the governor did was establish the Office of Health Information. Director Michelle Francis has engaged the entire healthcare infrastructure to establish, the purpose is to establish a health information exchange. But the prerequisite for having a health information exchange is you have to have, all of the healthcare infrastructure have to have their processes automated. So,
and I know that Michelle and her team, I know Dr. Julia Sheen is also part of that project, implemented or I think it was actually done within the government house where we had a health summit. I was in St. Croix. I didn't get to come over, unfortunately. But it was a tremendous, we had people from off island come in. And so tell us a little bit about that. Kudos to them, first of all.
Yes, it was a very successful event. We had the reception here at Government House. The actual summit took place at the Turnbull Library. And it was, the governor was there, and Dr. Sheen gave an impassioned speech. Dr. Carter was there, and he led us through the history of implementation, telehealth and telemedicine in the territory, and it was like a class.
Really? So I'm going to shift to you for a second, because I know telemedicine is something near and dear to your heart. So what have we been doing in health? Let the general public know some of the things that we've been doing to enhance access to care using telehealth.
Well, telehealth is something that I really, when I came to the territory, thought that it was going to be something that can really be useful. That was.
You're saying coming to the territory, weren't you born here? You mean
Yeah, when I
coming back
came
home?
back, when I
Okay.
came back home, right after fellowship, telemedicine was something that was not used a lot, but I thought that it was something ideal that we could use within the territory and even in the entire like Caribbean.
Yeah.
So when COVID came about and mitigation was important to really stop the disease spread, it's very important that everyone understood and the community understood that you have to continue. The healthcare had to continue, and doctor visits and just keeping up with your chronic diseases management was truly successful with telemedicine. So we used it for COVID, and I think that we can probably also continue to use it just throughout for all kinds of services that we can't even have in the territory, like what we're doing at MCH and with behavioral health.
Now, MCH also had a health IT segment, which I think was awesome. So what it's saying now is that pediatric services can be enhanced. For a long time, we didn't have specialty pediatric care. This allows us some of that.
Absolutely.
So we're very proud of what they're doing at MCH and that. So we have so much more to speak about. Once again, we will take a little break and be back to speak with you.
We're expecting a strengthening storm as it makes landfall. The right side.
Hey, babe. I listened to the radio and they said it's starting to strong.
Well, the house on lockdown and all the shutters are out. Should probably go check on it.
Okay, I think that's a good idea.
Alright, let's go.
So you don't know we don't think our roof, we take care of everything we need to take care of?
Oh, we gotta check on Becca.
Oh, what you done today? Rebecca! You good?
Oh, hi. I'm okay.
We know you're expecting soon. We come to check on you.
Yes, I talked to my doctor. We have a plan.
Okay, no problem, man.
Checking on me. Bye.
Miss Carmen, you good?
Yeah, somebody come and check on me.
All right, take care. Michelle. Evening. You ready for tonight? You know you went through a hard time last year with a hurricane, If you want, you can come and stay away.
I'm feeling nervous, so I'm gonna come tough it over you, okay?
Once again, welcome back to Season 3, Episode 12 of the Press Box. Congratulations also to you guys because you've been doing a wonderful job. We've been on Press Box for a long time, right? So it's actually, we haven't been in here for a few months and it's happy to get back here with you. I want to go back to some of the things that you were speaking about. And that is having to do with telehealth services and why it became a little bit more accessible, and that's COVID. So let's talk about COVID. So what's going on with COVID these days?
Well, what we're seeing right now is the continuous evolution of the variants and the natural progression of what happens when you have a pandemic. So we've heard a lot of talks and about what endemicity is. So right now we are currently in the phase of the pandemic in which COVID is endemic, meaning that it's existing in our community and even around the world, and always going to be in low levels, sometimes with spikes, but it's here and we have to always just be aware and cautious of any additional outbreak surges and even the development of harmful variants. Right now, we're seeing that we still have predominantly the Omicron variant that's circulating, but there are subvariants of the Omicron variant that might be a little bit more contagious. What that means is that even if you've had COVID in the past, you might not be immune to this actual variant. But the best way to protect yourself against COVID is to be vaccinated, to be fully vaccinated, and be up to date and current with boosters if you are eligible.
I have to tell you that we really only have about a 56% vaccination rate at this point in time, which still isn't the
Very
best.
low.
I think that many of us, especially with the Omicron, went through really quickly on St. Thomas and then on St. Croix, and we have gained some immunity level as a result of that. But like you said, the variants continue.
Absolutely.
And so it's very important still for you to go ahead and get your vaccines. And we have the vaccines available from 6 months now
And
to
older.
adult. Yeah,
Absolutely.
so this is an opportune time for you to get in there. Every day, I look at the numbers. One day it's 60 positive, one day it's only 10 positives, but most of the time it's above 25.
Absolutely.
So it's still very much into our community. And we're seeing, and the last time we had a death, I think was like a week and a half ago.
Correct.
So people are still dying of COVID.
And more importantly, people are still dying of COVID among people who are not vaccinated. So
Correct.
that's what really
Yeah.
makes me very sad.
And we
to
still
hear.
have hospitalizations, right?
We still have hospitalizations. On any given day, we have in the territory anywhere between 1 to 6 or so on average in the territory hospitalized.
Today, I think we have about 5. I know we have 3 in
Correct.
St. Thomas. I think we have about 2 in St. Croix.
Correct.
And so we're still seeing it. So, I mean, you see, the smile is no longer on my face. And that is because it is serious. And because we have to make sure that vaccinations are there. And I have to tell you that it helps you in so many different ways. And so we want to encourage you, especially in schools. Schools are opening now. So you don't want COVID. We actually had to close down one school in the beginning of the school year because teachers were positive. So we need to make sure that it's across the line. It's not just for adults, it's the children, grandparents.
It's for everyone.
Yeah, every age group.
It's for
adult
everyone.
age.
And unfortunately, we are not seeing the amount of vaccinations that we would like to see in the 12 and under population.
Yes.
And it's even much smaller in the 5 and younger population. I would say that we only have a handful of.
You have a below 12, right?
Absolutely. I have a 6-year-old,
Yeah.
and she is vaccinated and boosted. so she, she is ready and prepared, and and as the the fall season goes, she asked me, "Mommy, when am I gonna get my flu shot?" I was like, "You're gonna get your flu shot soon, and as soon as it comes out, you're gonna see your doctor. You're gonna get it." She's like, "Okay."
Excellent promotion. So this is August, September, October. When does flu season actually begin?
Flu season begins in the fall and goes into the winter months and extends to maybe early spring. So the territory usually gets its flu shots around the month of September and October, sometimes even as early as August. So just keep up with your healthcare provider and see when it's available for you.
Now, when COVID was in full swing, everyone had their mask on. So that year, we actually had a reduction of flu.
Absolutely.
And then last year, we saw a little increase of the flu because not too many people were wearing their masks.
Correct.
Now, this year, we know mask mandate is not in place. However, I have to say I'm proud to see that a lot of people still wear their masks indoors. I really am proud to see that. However, you need to make sure that you continue that because then we will see the flu rising if we're not careful with that.
Absolutely.
Now, this is National Immunization Month, so thank you for that conversation and the plug out there to go out and get your immunization, especially during this month. Make us proud, everyone. Now, we still have COVID testing going on.
Yes, we have COVID testing that's available free of charge to the Department of Health by appointment only.
Okay, that's good. And so you can still go online?
Absolutely.
Okay.
It's still available Monday through Friday. No holidays, but if you need to get tested, you can call, get an appointment, and get tested that same day. Usually, because the demand is not so high.
Now, I usually introduce Dr. Ty Hunt Caesar as our infectious disease expert. Today, I didn't do that. I just introduced you as our medical director, but I have to tell you that we have done tremendously well because of the team that we put together, and you definitely leading that health portion of the team. You have done an awesome job.
Well, thank you.
Thank you so much.
It's because of fantastic leadership and all of the team, all the people behind the scenes, like our Chief of Staff, Shannon Riley, she keeps us all together. So like it's an entire team. But it does help that I did a fellowship in infectious diseases.
Yes. Is that right?
Yes.
You can't
That was helpful.
put that down.
Yes.
So I know that you were eager to help us with that, and I really, really thank you for that. This psychologist over here, he has a degree in psychology, so he doesn't speak much when it comes to certain occasions, but you're over here smiling.
I'm just enjoying the relishing in our success. We work hard, and we
have fun.
We have fun, and we have to acknowledge our success. And again, thank you for all that you have done, and you
Oh, thank you.
for your leadership.
No, the general audience don't want to hear that though. So let's go back to what we do. I want to go back to you. Tell us a little bit more about some of the projects on St. Thomas. And St. John. We can't leave St. John, our most beautiful Virgin Island.
Yes, we have several projects on St. Thomas. I've already mentioned the Wicknute Hansen project. We are also demolishing what we call the old mental health building. I understand that someone who's sitting with us, not Dr. Hunt, did their internship in that old mental health building some point in time. So that building is going to be demolished. And as you stated, we pay tribute to the past and acknowledge what those structures have done for our community. So we're replacing it with a parking lot. We have, and that is partially USDA and FEMA funded, different portions of it. We have projects to rehabilitate every building in the John Moorhead Yard, including the Women's Health Building that was lightly used throughout the years. And we have an Eldridge Schlotterbrand project for the annex. So the annex is a complex project. While FEMA approved repairing of it based on engineering surveys that was done, the structure is not would not be adequate. It would not be up to standards. So it makes little sense in rehabilitating a building whose foundation is not where it needs to be as far as the current codes and standards. So we're going through the FEMA process to appeal that decision and to get that building actually replaced.
Since you're speaking about behavioral health, I'm going to chime in just a little bit. And first of all, thanks to the 34th legislature for hearing us with the behavioral health bill and passing it from the Health, Hospital, and Human Services Committee, chaired by Senator Francis, into the Rules and Judiciary Committee. And so we're looking for the outcome, towards the outcome of that. We have some homework to do. We're doing that now. But that bill was critical because it not only speaks to clinical care of the behavioral health population, but it actually pulled a lot of other, like NAMI was involved in that. We tried to include everyone in that bill, Department of Justice, as well as Human Services. VIPD was involved. So it was a great collaboration to get the bill where it is right now. So we're thankful for that. But part of that bill also spoke to infrastructure and what we're going to do, because wraparound services are great. And I think that we have Deputy Commissioner Renan Steele. I always give him kudos to this. He has done a tremendous job since he's come back home. We're bringing a lot of people back home and joining our team. And he's done about over 20 years of behavioral health care services in Florida. So we got him back home and he's working with us. But the type of wraparound services that he now is implementing into the behavioral health division, I think it is really awesome. Community health workers, part of behavioral health. So they're now going back into the community. Thanks again to the legislature, we have the vans on all 3 of the islands so that we can go out to look at that. But part of the bill spoke to a percentage of funding that's going to be appropriated to building a facility.
Yes,
it's wonderful, right?
Yes.
So what other options do we have out there? Because everyone's, and I know some of you looking at it is going to say, you know what, it's about time. This is what we need and we need now. So what can we do in a rapid manner to help us with that?
Thank you. So the funding process and the approval process is complex and takes a long time. But thanks to Governor Bryan establishing the Office of Disaster Recovery, who has have master contracts with the resources that we would need to facilitate the more efficient and more timely completion of these projects, we're able to tap into ODR's pool of architectural engineering firms. Wherever we needed support with project management, we're able to get that support. And wherever we needed to escalate within the FEMA process, escalate a situation, Director Williams-Acklin has been there to support you. First it gets escalated to you, and you're the one who requests Director Acklin's resource. But I'm glad you mentioned, because on St. Croix, our plan is to use the Anna's Hope property to build what we estimate to be a $30 million facility.
But we don't have to wait until we get $30 million, right?
No. So tapping into ODR, we can get architectural engineering firm involved, and we can get a realistic cost estimate.
There is also a structure on that plot of land, but we did some assessment, and what did it show?
We did an assessment, and number one, the infrastructure would not have been up to code. So again, that would be the foundation. It made no sense to build on top of a foundation that was not where it needed to be. We, working with Public Works, Public Works helped us in making that determination, and they determined that they didn't have the resources to design a facility, so we tapped into ODR.
And that's a plot of land that was given to us by the legislature.
Correct.
So I have to say that I have a piece of paper in my hand, it's in my desk, I should say, that says that we now have permission to utilize some of the funding to do just what you're talking about.
Excellent.
So
folks get impatient with the process, but what you see is a tip of the iceberg. The amount of work and effort that goes into getting us to this point is tremendous, and it requires a collaboration from all the resources. Mentioned Public Works, I've mentioned Property and Procurement, I've mentioned ODR, and FEMA. In this instance, it's not a FEMA project, but FEMA is prominent, and we rely on resources like Widow Bryan to ensure that whatever we do is we tap into the experts in that area, and it's not just something simply of what we think is best. The experts in the area, we have tapped into experts in that area to help us support in developing and establishing what we need to establish.
Now, I know that we've also had a conversation with the VI Finance Authority to see whether or not we could put in an application that would allow us to get some funding for that. So, just to let you know, we're really trying so many different things, and we have another idea in our heads. We can't tell you that. We have to wait until we see whether or not that works out, but we really and truly are trying to get a facility. But I think it's important, if Dr. Sims was here, she would say this as well. It's important to note from a behavioral health aspect that the key is prevention, and behavioral health challenges and mental health issues it is going to be continue to occur within. Excuse the noise, but we're gonna continue to speak. So, but at the same time, behavioral health challenges will always be here, but it's for us to recognize what they are, and education is one of the things that we will be doing. However, going back to the wraparound services to prevent them from allowing that to occur without identification of an exacerbation of symptoms. Because what happens is that when those symptoms are exacerbated, they go into the hospital system. We now need to pull them back into the Department of Health and a public health entity or just an outpatient facility so that we can stabilize them and continue to work with the family members, because that support system is definitely needed. That's one of the things that we've been able to do more and more. Our hospitalizations are decreasing because our wraparound services are increasing. But yes, there is a need for short-term wraparound services from an inpatient standpoint. The need is there for long-term care so we could bring some of our patients back home. So those things that we're working on, we'll continue to work on. But let me just say this. This just doesn't happen overnight. One of the things that we have done since we become a team is we've worked with on our strategic plan, our 5-year strategic plan. And kudos to Dr. Janice Valmont on that. And we had a health strategist working with us, and I'm so proud always to say this, but Dr. Christensen, Donna Christensen, our former delegate to Congress, was part of our team. For outside purposes, still a part of our team. And they worked together. We pulled a community health assessment after our strategic plan was done. That started, and we had over 500 individuals within the territory that spoke to us, let us know what they thought their social determinants of health were and what we needed to do to improve that. So now we have our community health improvement plan that's together, and you can go on our website, our DOH website, and pull that plan down. So you see the strategic plan, you'll see the CHA, the community health assessment, and based on that assessment, you'll see our community health improvement plan. So those kind of things is what we're trying to do, be more progressive in our performance improvement methodologies, and I think that we have become a little bit more successful because we're doing that. And it goes back to consistency in what you do and the way in which you do it leads to more success.
Developing those plans requires us to collaborate with the breadth of stakeholders in the territory. So developing a plan takes time because we make sure that we get everyone's input in establishing a plan. Once you've established a plan, you lay out a timeline, a roadmap for accomplishing the objectives in the plan, and it allows you to have a focused effort.
And you can't put the plan down and say it's gone done. We have to pull it back out every so often and really check them off.
Document.
Right. We had help with our plan through ASTO, which is Association of State and Territory Health Officials. Very happy to work with them. We work with CDC. The CDC actually support us by funding ASTO to help us. So I think it's a federal collaboration as well. And so we work with ASTO. We meet with ASTO every week. We continue to do so, more on a clinical aspect. So, but when there's something that's interesting, something that I think that the other team members need to participate in, we pull them on to the call as well. So ASTO has supported us in trying to figure out how we are going to continue the health improvement. One of the latest things that we are looking at is our mission. Our mission does not speak to equity. And so we're now looking at revising our mission to make sure that we include the word equity and decreasing disparities. And I think we spoke about that in general, but I think that it's important for us to continue that process. So, and a strategic plan is not written in stone. It's not written in blood. So what we're doing now is how do we now enhance what we spoke about 2 years ago? And how do we make a change on that? So Department of Health is evolving as every other department within the government. And I think that one of the things that Governor Bryan has done is really try to bring a wonderful team together, not just in health, but also linking us, looking at a leadership proportion. For example, we did leadership training in ASTO. We brought leadership training to the Department of Health, and the governor in turn brought leadership training to the cabinet. We're meeting tomorrow, right in this room. So I think that we really and truly are exploring new ways in collaborating and growing as a team. So you are a black belt, Six Sigma, right?
Lean Six Sigma.
Right, and so is Dr. Sims.
Yes.
So process improvement, talk to us a little bit about that.
Well, the pillars to achieving operational efficiency is you deal with people, process, and technology, and environment includes in technology. So you have the right people, with the appropriate skills, but you have to provide them with direction and guidance. The planning process does that, but from day-to-day operations, you need to establish policies and procedures. You need to define processes. You need to implement a system that allows you to evaluate the process and improve upon it when it's necessary. So Lean Six Sigma prepares us, and you are also Lean Six Sigma trained.
Yes, I am.
Okay, so Lean Six Sigma allows us to continually monitor our processes. First of all, identify them, monitor them, and improve upon them in a way that achieves the business objective of the organization.
Now, there's another process improvement methodology that we use all the time that we probably don't look at it like that. But before we go to commercial, I want to speak about that. And that's a thanks to FEMA and VITEMA. And that is the Incident Command System. And since we have started with our COVID initiatives and now our monkeypox initiative, we implement ICS. And what that does is more of a meeting management structural methodology that allows us to improve as well. Well, we could talk about that all day as we could talk about clinical.
One essential skill that everyone needs to have is project management skills.
Right.
And ICS system allows you to manage situations, manage
Either
the project.
that or have to grow up in Catholic school with the nuns.
Right.
But
So, yeah.
we're going to take a quick break and then we'll come back. Thank you.
But what you saying, Jimmy? Me taking a hot minute, you know. We're going on today, it's been a hot minute for real. You want to know something? My mother told me that I can't come out my house because of COVID-19. I know we ain't safe out here for a little bit, but still I just have some fun though. Well, my side can't leave the house unless I'm vaccinated. But you won't scared of the vaccine? Nah, sis. The vaccine's safe.
VIP people, you must stay at work. COVID-19 is not a joke. It's much more than good hygiene. Give your children the vaccine. Education is the golden rule. Children need in-person school. They miss music, dancing and sports. Vaccination is better not worse. I want the COVID vaccine. Give me the COVID vaccine. It's safe, mommy. The vaccine safe, safe, safe. I want to see my friends and family. Playing with them makes me happy. It's safe, mommy. The vaccine safe, safe, safe. Children can become infected, get sick, and spread COVID-19 to others. Widespread vaccination is a critical tool to help stop the pandemic. People who are fully vaccinated can resume activities that they did prior to the pandemic. The MCH division encourages you to get your children ages 12 years and older vaccinated. I want the COVID vaccine. Give me the COVID vaccine. It's safe, mommy. The vaccine safe, safe, safe. Brought to you by the Virgin Islands Department of Health MCH program.
Welcome back. And sad to say, we have to say goodbye, right? So, Ruben, I'm going to start with you, AC.
So thank you, Commissioner, for giving me the opportunity to participate in communicating with the public. A lot of what you see in the public is again, like the tip of the iceberg. The efforts that lead to that tip of the iceberg is often goes unnoticed. And this is an opportunity to provide the public with some of the activities that go on behind the scenes.
I'm so happy that you said it because it just triggered one of the things that we did not speak about. And hospitals are semi-autonomous. They're not under health. However, I'm on the board for both the territorial board for the hospitals. And I know you speak with Mr. Smalls, who is now working on JFL North, and a lot of controversy has been, what is it that we do with JFL North? So quickly, in let's say 5 seconds, tell us what's going on with JFL North.
JFL North is progressing, making the necessary adjustments to address the facilities situation at the One Lefevue Hospital and Medical Center. And it's, again, the powers that be identified the need to establish a group to focus on the rebuilding of JFL and JFL North. So Darrell comes very accomplished. He's former Commissioner of Public Works, and local product, and he is leading that effort.
He's doing an awesome job.
Doing an awesome job.
And so, yeah, there have been some hiccups, but I really want to let the general public know that we are progressing, and JFL North will be open within the end of the year. And I know it's been too long. Trust me, I've been there. I feel it. I push as much as possible, being part of the board. But we are there to support you, but to note that services are still being provided in both hospitals, and very good services are being provided from physicians like you, Dr. Hunt Caesar.
Yes. Well, just closing remarks from me is just so that everyone remembers that COVID is still here. Get your vaccine, be up to date, be current. Just be current with the most recent updates. Educate yourself educate yourself with reputable sources. Come to us with any questions from the Department of Health. Stay off of social media for your major form of information. Get the facts so that you know how to prevent any illnesses. Flu shot this fall, and just stay informed on the monkeypox to see if you're eligible for the vaccine. And thank you to Commissioner Encarnacion. Thank you, AC Malloy. This has been fun.
Thank you so much. We really have been having a lot of fun. And I do want to ask you to follow us on Facebook, as well as go to our website, doh.vi.gov, for more information. And we will be back on Press Box sometime soon, and be able to share some more information. We'll bring some of our other colleagues here as well to speak with you. Thank you so much, colleagues. This has been tremendous. I've had a good time. I'm hoping that you enjoyed the conversation as well. We thank you for tuning in, and God bless each and every one of you. Thank you.